Hello, this is Maria Steens. I'm an occupational therapy student and future occupational therapist. Today, I will be talking with you about addressing overactive bladder as well as urinary leakage. So we'll talk about these terms if they feel a little unfamiliar to you. So an overactive bladder is essentially a bladder in which it is reacting to every small sensation to need to use the restroom. So if you have overactive bladder, you may be using the restroom every hour, every 30 minutes, or just way more frequently than you should be. And we'll talk about that frequency later. And urinary leakage is just simply leaking urine, whether it is on your way to the restroom because you're unable to hold it on your way, or maybe with coughing, sneezing, laughing, things like that might press some pressure on your pelvic floor. So today we're going to be talking about addressing these things, some simple techniques to try at home. But first, I want you guys to know that if you're experiencing this, you are not alone. 48% of non-institutionalized Americans over the age of 65 actually experience urinary leakage. So it's definitely not uncommon, but there is a myth that this is just a typical part of aging, and really that is not the case, and it doesn't have to be the case. So using some of these techniques that we talk about today can help you move forward without having these incidences of urinary leakage or frequent trips to the restroom. And I do want to mention that people with Parkinson's tend to have an increase in these symptoms, so these overactive bladder and the urinary leakage. In fact, Parkinson's actually affects some of the brain structures that control your bladder and urine output. So that is one of the many reasons why Parkinson's can impact a person in this way. And so I want to first start by just talking about what a healthy bladder is. So oftentimes when we experience the urge to go, we are actually only at 40% capacity of our bladder. And so when we go at this very first urge, over and over, we're going to become hypersensitive over time, and our bladder is going to be filled less and less over time as we get this urge and we go to the bathroom. In fact, if you wait past this first urge and wait for a second urge to come along later, you will wait until your bladder is almost 70% full. So that's right, at the second urge, or the second time that you've experienced the urge, your bladder is now 70% full. And then at max capacity, or 100% full, your bladder is actually holding 14 to 20 ounces of fluid. So I don't recommend getting to that full capacity, but recognize that when you have that first urge, your bladder is not full and it has the capacity to grow much larger, so you don't need to act on it, especially since it helps it actually deconditions your bladder over time if you're acting on that first urge. So we'll talk about that, and we'll talk about urge suppression drills that can help you kind of build up your bladder's tolerance and retrain your bladder if you are experiencing overactive bladder. And so I also want to talk about what a healthy frequency is. So a healthy individual and a healthy bladder should be going 2 to 4 hours. So if you're going more frequently than this, it tells me that maybe you're not emptying all the way, or maybe you're not allowing your bladder to fill as much as it has the capacity to. And if you're going less frequently than this, so say 5-6 hours at a time, that tells me that maybe you need to be a little more hydrated. So try drinking a little bit more. So really aiming for that 2 to 4 frequency range. And then lastly, frequency overnight. If you're under the age of 65, you really shouldn't have to use the restroom overnight. And if you are over the age of 65, really no more than 2 to 3 trips to the bathroom overnight is appropriate considering a healthy bladder. Lastly, just thinking about effort and abilities. So there should be no straining, no pushing. It should actually be a relaxation of your pelvic floor. And then abilities, you should be able to make it to the restroom without a leakage every single time. You should be able to make it past that first urge, and you shouldn't have any sort of leakage when you are coughing, sneezing, laughing, things like that. So that's kind of what a healthy bladder looks like, and don't be discouraged if that doesn't sound like your bladder. We're going to talk about some techniques that can address these things. So the first one is just general good habits. So one thing I really like to talk about is not getting in the habit of like just in case toileting trips. So if you don't need to use the restroom and you're just like going just in case, this is actually doing exactly what we talked about earlier. It's deconditioning your bladder. And so this is a really bad habit to form for your bladder because you are going to actually cause it to become hypersensitive to every little urge over time. And so it's going to become way less effective. So let's avoid those just in case trips to the bathroom. Another one I like to talk about is right before bed, and this is really the only time that I really think this is an appropriate thing to do. We call it double voiding. So if you are someone who goes to the bathroom frequently overnight, you may want to consider double voiding. So what this looks like is you sit down on the toilet, you relax and you pee, and then you get up, maybe brush your teeth, leave the toilet for a little bit, and then visit it one more time. Even if all you do is stand up from the toilet and then sit back down, and give yourself that extra minute or two on the toilet a second time around to really relax and empty your bladder fully. So that's another option. And then another just general tip for good bladder hygiene is to avoid things that we call bladder irritants. So this is anything that irritates your bladder and causes you to go more frequently. So I bet you can think of a few foods and drinks that fall within this category, but I'll go ahead and give you a couple. Caffeine, alcohol, citrus fruits, so like oranges, lemons, like anything acidic, as well as nicotine, so spicy foods, anything like that can irritate your bladder and make you go more frequently. So you don't have to cut these out, but just consider limiting them over time. The next thing that I want to talk about is pelvic contractions, and we're actually going to practice this together. So this is a way to strengthen your pelvic floor. And if you are unfamiliar with your pelvic floor, it is actually several layers of muscles that lie at the bottom of your pelvis. And so these muscles can become weaker over time, especially with age and especially with Parkinson's disease. And so by strengthening your pelvic floor, you can help prevent, urinary leakage and frequent urination, things like that. So we're going to practice together, and the best way for me to do this is to give you guys a couple different things to visualize as kind of cues. And don't get discouraged if you don't feel like you're doing it right. It takes a lot of practice, so don't give up. Keep trying to practice this at home. So one thing I want to preface this with, it shouldn't be a contraction of your thighs. It should not be a contraction of your glutes or your abdominals. It really is just this isolated pelvic floor, and it's going to be a different contraction. And so these are also called Kegels, if you've heard of them, and they're appropriate for both females and males. So the first one we're going to talk about is just bringing your tailbone to your pubic bone. So that's kind of what I want you to visualize. We're going to start by relaxing our abdominal muscles. So I want you guys to just get into a relaxed position. And then we are going to do some deep breathing. So go ahead and inhale big for me. And exhale big. And while we are doing this breathing, I want you to try to imagine bringing your pubic bone, we're going to pretend this is the pubic bone, to your tailbone. So actually squeezing them together. And as you do this, I want you to do it while you are exhaling. So we're going to go ahead and practice this. Go ahead and inhale. And on the exhale, squeeze the pubic bone and the tailbone together. And relax it and inhale. And then squeeze the pubic bone and the tailbone together. Let's try one more time. Inhale. And then squeeze the pubic bone and the tailbone together. Great. And if that didn't work for you, I have a couple other things to visualize. So the second option that you can think about is a jellyfish. So actually thinking of that floor of your pelvis as a jellyfish. And when we exhale, I want you to think about pulling the jellyfish up. So this jellyfish is kind of like swimming up. So we're going to try that again. On the inhale, relax. And on the exhale, we're going to pull up like a jellyfish. Let's go ahead and relax again and inhale. And then pull up like a jellyfish. And one more time, inhale. And then relax, or pull up like a jellyfish. Very good. So that is just another way that you can visualize this and think about it. And then the final way, which can be a little more helpful for males, is to think about stopping midstream or having to stop peeing. And so this is just another way to kind of think about the contraction. So we're going to try the same thing with our deep breaths. So go ahead and inhale, and then exhale and think about stopping midstream. And we'll inhale again and stop midstream. And then inhale one more time, and then exhale and stop. Very good. So if none of those worked for you, that's okay. Practice makes perfect, so continue to practice those with time. You can use these as like an exercise routine, so doing them, twice a day, 15 times each time, or you can even just incorporate it into your daily life. So I really like recommending just doing about 5 to 10 of these every time you've finished on the toilet. So while you're still sitting there, just doing some pelvic floor contractions. It's a great way to remind yourself to do them. But really you can do them anywhere. Nobody even knows that you're doing them. So they are super easy to perform anywhere, anytime. But I want to talk about how you can apply this to suppressing that urge, that first urge we talked about. So if you're somebody who goes to the bathroom frequently, then this is a really great way. You can use these pelvic floor contractions to help you prevent leaking on the way there and prevent rushing to the bathroom, maybe even prevent going on that first urge and allowing that second urge to come along. So when I'm talking about urge suppression drills, this is what I'm saying. So when you get that first urge, the first thing I want you to do is just sit still, stand still, don't move. Don't try to rush to the restroom. Just take a couple deep breaths in, and I want you to either perform 5 to 10 quick pelvic floor contractions or one long sustained one for about 10 seconds, whatever's easiest for you. So practice these first before you do this urge suppression drill. So after you've done that, you may want to continue doing some pelvic floor contractions, or even distract yourself from the thought that you have to go to the bathroom, counting backwards from 100 by 3, or thinking about what you ate yesterday for breakfast, whatever it may be, but allowing yourself to distract yourself from that urge while you're doing those pelvic floor contractions. If the urge goes away within 2, 3, 4 minutes, then go ahead and take your time, do whatever you were doing before. Don't go to the bathroom. This is a great way to retrain your bladder. Even if the urge comes back 10 minutes from now, you are helping your bladder slowly become able to maximally fill. And if that urge does not go away, then don't sweat it. Just try to calmly and slowly walk to the bathroom after you've done this urge suppression. So after you've stood still, taken those deep breaths and performed those pelvic contractions and tried to distract yourself. Now you'll be able to more slowly walk to the restroom and likely not have to leak on the way there. So regardless of how you use these urge suppression drills, they can be super helpful. And the last thing I want to talk about is just how you can use these to slowly retrain your bladder over time. So if you're someone who goes every hour, maybe set a goal for yourself to go every hour and a half. And if that urge comes before the hour and a half mark, then really try to suppress that urge, use these drills, and make it to that hour and a half mark. Don't sweat it if it doesn't happen every time, but celebrate it when it does, and slowly over time it'll get easier. So these are just a couple ways that you can work on addressing urinary leakage and overactive bladders at home. So I hope that was helpful, and thank you for joining us today at iClimb.